The first meeting of the 22 regular session of meeting of State Government Committee. Few people are still straggling in, so I'll do the announcements first. Please remember to silence your cell phone when you're speaking. Turn on your microphone. Those watching online, please make sure you unmute if you need to talk. We've got the similar committee procedures to last year. Our committee meetings will last 1 hour. Bill's not posted committee and sponsor until sponsor gives assurance it can pass both committee and the full House. Speaking limit is 3 minutes per member, unless changed by the chair. And if you have spoken, you get 1 minute to explain your vote, and if you have not spoken, you'll get 2 minutes to explain your vote. Members can vote remotely, but they must be on the Capitol campus. And as always, I will try to get you committee substitutes as early as possible, no later than midnight of the day before. I have a special guest today I'm going to introduce. It's my granddaughter, Kate Kelly, who is a 7th grader in JCPS. Kate, welcome.
Hello.
She's over there. Welcome. She's very interested in public policy. So in any event, Madam Secretary, please call the roll.
Representative Decker.
Present.
Representative Duplessis.
Present.
Representative Flood. Representative Graham.
Here.
Representative Heath.
Here.
Representative Heverin.
Present.
Representative Johnson. Representative Maddox.
Here.
Representative Mentor.
Here.
Representative Nemus.
Here in the room.
Representative Smith.
Here in my office.
Thank you. Representative Stevenson.
Here.
Representative Tate. Representative Tipton.
Present in the room.
Representative Upchurch. Representative Wheatley.
Here.
Representative Bowling.
Here.
Representative Bratcher.
Here.
Representative Miller.
Present. And I believe we have a quorum. And first item on the agenda is Senate Bill 25, sponsored by Senator Wise. While there is a committee sub, I don't want to call the sub yet because Senator Wise has to leave. So after he presents the original Senate Bill 25, I will call the sub. So welcome, Senator Wise.
Mr. Chairman, thank you. I think this is the first time I've appeared before your committee, so thank you for the opportunity to present Senate Bill 25 that is before you all. Senate Bill 25, in essence, is an extension upon work that both chambers did during the special session of Senate Bill 1 as related to COVID-19 for our educational school systems. Many of the issues from Senate Bill 25 remain in effect of what was put forth with Senate Bill 1. However, there were a few things that needed extensions because there were deadlines of December 31st of this past year that we had to go back into a Senate Bill 25 to grant those extensions going forward. I would provide those extensions are for absences related to COVID-19 absences for school districts, remote instruction days. Now, I do want everyone in the audience to know before here and also viewing, remote instruction is not NTI. NTI, non-traditional instruction, is separate than remote instruction. Remote instruction is a full educational day of learning that is provided in a remote fashion, but that is different than NTI. It does say in the bill before you that there will be 10 days given per school, different than what we had in Senate Bill 1, which was per school district. This is more of a surgical strike of where if you have a 5th grade class that needs to be shut down for COVID-19, a school building can close that particular grade. If they wish to do an entire high school, they can do so. So instead of a district completely closing down, this would be more of a strike to those individuals within the school building. Also with this, there was an expiration of those 10 days we gave in Senate Bill 1 in the special session. Those all expired as of December 31st. We're not tacking on a days from previously, so this starts now with 10. This does not affect NTI. This is not extending NTI. This is just for those remote instruction days. It also allows flexibility with hiring, especially within KTRS. For those substitutes that we're needing right now, this does allow part or full-time certified or classified positions who have completed the minimum requirements to be able to do so, that they can be a break in their employment for 1 month. This extends as well for those wishing to help in that aspect. And lastly, this also extends the hiring threshold from 1% to 10% of staff. That also is an extension. We've seen the need for more staff, so we have also increased that. With KTRS, there is no impact. There was an actuarial analysis done to this bill. There is no impact whatsoever to the pension, even with raising that threshold from 1% to 10% as it's put forth. Mr. Chairman, I'm open for any questions, but that in terms of the extensions, those are the main issues
Very
of the
good.
bill.
So I'd like to have questions on the education portion of the bill, which is what Senator Wise just presented. So does anyone have any questions about it? Representative Nemus.
Thank you, Mr. Chairman. Senator, I want to thank you for bringing this bill. My understanding is this is going to keep the kids in Jefferson County public schools in school more. What it does, I think, and make sure I'm right about this, is it gives my superintendent the option. We have 155 schools, and it gives them more options. 17% of our teachers have COVID and were unable to come to school, and so that's the reason that we're out of school this week. Those 17% are not uniform throughout the county. So it might be that Fern Creek needs to be take off, but Eastern High School does not. And is it your view that what this does is it gives the superintendent of JCPS and other superintendents more flexibility to keep the remainder of the kids within our counties in school?
Representative, thank you for the question, and you're exactly right. My goal, and I think it's the goal for everyone, is in-person learning at all advantageous reasons. We know that is what's best for children. This does provide flexibility for superintendents to make that decision. And once again, without completing shutting down an entire district, it's more of that surgical strike to do so within school walls.
Representative from Franklin.
Wanted to ask the question with regards to the larger school districts, and I have two school districts. I have the county school, which is larger, and the city school. With regards to places like Bowling Green, my colleague sitting next to me, Lexington, Louisville, some of the bigger communities that have a number of schools, this will give the superintendent, my understanding from this bill is that the superintendent working with the different schools within the district will decide which schools are open. So one high school on one side of the county could still be in operation with the other having COVID issues and having to shut down the school. So how will that internally with the districts, for example, in terms of the school days that they have to be in and the initial end of the school year, how will that impact if one district or one part of the district is out of school for 10 days? How will that impact in terms of the end of the year situation?
So, Representative Graham, good question. And so with these 10 remote instruction days, remember this is separate than the NTI
Right.
days that could be utilized. If we were to say, okay, if it's, I'm going to use Warren East High School. If Warren East High School is needing for the 9th grade from Warren East High School to shut down, that's 1 day for Warren East High School just for that grade. Okay. So they have 9 days left of using these remote instruction days, which will be added on for them to be able to utilize. If it's for a 5th grade class or if it's for a basketball team, all of a sudden they've got it. It's spread throughout, and they decided for whatever reason, those 10 days are used per school building to be able to utilize for this. So it does provide that great flexibility. Remember also, we have in this legislation 1,062 hours that school districts can utilize if they wish to make up time frame lost with using that. We've seen some districts right now adding 30 minutes onto a daily routine. That could be 15 minutes in the morning, 15 minutes in the afternoon. So to make up those days lost, they can use the equivalency of the flexibility of the 1,062 hours, which we've seen already has been benefiting many school districts statewide.
Are these superintendents from the larger districts, are they supportive of this particular bill?
I have had no opposition. When we had this bill passed 31-2 in the Senate, we had every associational group supportive of this bill. I had no pushback at all.
Okay, thank you. Thank you,
welcome.
Mr. Chairman.
Yes, sir.
Thank you. Representative Duplessis.
Thank you. Just a quick clarifying question, and thank you for this bill. I have a school in my district that it's an elementary and a middle school that share a cafeteria. So they're an adjoining building, if you will, but they're separated. But then there's a cafeteria that joins them. Would this bill mean that if somebody in eighth grade if a class in eighth grade was let off, then that would also eliminate the elementary school, which is separate, but because of that one, the lunchroom.
The only thing and I've got my policy analyst Joe Burks here behind me who helped tremendously with this bill. The only way is if they're in the same school building. If the high school and the elementary school is in that, in terms of a cafeteria that may be within a corridor. Joe, if you don't mind, if I could have you come up to the table, please, just for clarification. That's a pretty nitty-gritty question we've never gotten before, Representative, so congratulations. You bring in the policy analyst. If you identify yourself for the record, Joe.
Staff. Joe Burks, policy staff with education. And typically, if there's no answer to the question, then they ask me to. There are a variety of settings, just like you explained. But the flexibility that has been given is instead of 20 days per district, where a superintendent has to figure this out and get the calculator out and figure it out, it's 10 per school. If the schools share the same buses and the same cafeteria, maybe not the same total building, but the same even campus, what do? And that is a local decision that could be made in the quarantine decisions that are being made. There are all kinds of innovations being done with test to stay. So that's almost a day-by-day decision, but it's not an automatic nobody comes or everybody comes or one school is out because the other school out. It is kid by kid, and it goes by those who are positive that are being isolated as opposed to having blanket policies.
I think, I don't, Mr. Chairman, I'd like to redirect. My question was, for this bill, if an eighth grade class is sent home for 2 days, would that count off? Well, I see what you're saying. That goes towards 10 regardless.
If it's two separate schools, it would not account for the other school.
That's
It
correct.
would. That was my question, but gotcha. Okay, thank you so much.
Thank you, Representative.
Other questions? Senator, I think you've satisfied the committee.
Thank you, Mr. Chairman. Thank you for your time. Thank you, members, for your vote.
You're welcome. And so at this time, I'm going to ask for a motion to accept the committee sub. We have a motion and a second. All in favor of accepting the committee sub, please signify by saying aye. Aye. Opposed, like sign. So the sub is before us. Now, this is a little bit of a technical thing, so I'm going to read a description of the sub, and then I have a couple of trustee lawyers, one Rachel Volk at the table, and another Christy Van Tottenhove on Zoom if we need her for questions. I will tell you that this is what I am told that the House and the Senate leadership could agree on in terms of extension of emergency orders and some other matters. So we need to get this out and to the floor because several of our state of emergency expire before next Tuesday or next Monday. So, or Tuesday. So there is some urgency to this bill. First, I'll say Section 1 extends the state of emergency to April 14th, 2022, only to the extent necessary to secure federal emergency funding for federal programs such as SNAP benefits and to extend liability protections from Senate Bill 5 and Senate Bill 150. Section 2 extends executive orders relating to waiving costs for COVID testing and vaccinations, permitting online continuing education, and extending deadlines for license and certification renewals and payment of certain taxes and fees. Next is permitting vaccine boosters and 30-day refills on pharmaceuticals, allowing retired first responders and state employees to return to work, providing temporary total disability payments for frontline workers who are directed to quarantine, preventing price gouging, allowing pharmacists to order and administer COVID testing and vaccinations. Section 3 of the sub extends certain administrative orders relating to allowing state agencies to use digital signatures, allowing auto industry employers to file mass electronic unemployment insurance claims, annual leave for state workers, flexibility for waste management facilities, minor training, and master logger designations, allowing dentists to administer vaccines and out-of-state providers to perform COVID-related health care services, suspension of building codes for hospital overflow, federal waivers for Medicare, Medicaid, and CHIP. Section 4 extends certain administrative actions issued by boards and commissions in order to, for them to transition back to normal conditions, operations. Then we jump to a Section 5, 6, 7, 8, and 9 that starts on page 7, extends certain emergency administrative regulations related to federal OSHA, expedited hearings and workers' compensation, the wastewater grant program, low-income utility arrears, continuing education requirements, testing and vaccine shortages, and the visitation guidelines for long-term facilities. Section 10 says the governor cannot declare a new emergency based upon the same or substantially the similar facts or circumstances. Section 11 on page 9, if any suspension of statutes is included in an executive or administrative action, there must be prior approval of the Attorney General. Section 12, 13, and 14 deal with education, which you've already heard. Section 15 and 16 relate to extending, well, really, I guess most of the rest of it, extending the expired provisions of 2021 special session SB 1 through June 30, 2022, and making them effective retroactive to January 1, 2022. Then Section 15 and 16 are extensions and revisions that expired December 31 and resets the expiration to June 30, 2022. And these provisions will be retroactive to January 1. For COVID-19 absences, remote instructions may be temporarily provided to a particular school, grade, classroom, or group of no more than 10 days per school, not the entire district, which we really just discussed as well. Allows KTRS, actually I'm on the education side. All right, Section 17, declared emergency. This goes into effect upon signature by the governor. And then finally, it remains in effect without reauthorization, continues to stabilize school funding, assists with staffing shortages, and creates conditions for state and local health departments to support local school districts, COVID-19 plans for masking, contact tracing, and quarantining. For SEEK funding for 2022-23, it allows districts to use either 2018-19 or 2019-20 data for 2021-22 purposes. Attendance growth will be addressed during the 2022 session. Temporary waivers for utilizing certified, classified, emergency, and substitute staff. Background checks for superintendents may employ all individuals on probationary status after receiving background approval from the Kentucky Administrative Office of the Courts, while pending receipt of Kentucky State Police background checks. And finally, allow school districts to waive the 170 instructional days and utilize the equivalent 1,062 hours to accomplish makeup days under certain conditions. Questions, I'm going to allow you to direct your question to our lawyers, and Rachel Volk or Christy Van Tattenhove will answer as appropriate, depending on their areas of expertise. So with that, I'm going to throw it open for questions. Representative Graham.
No, I raised my hand so that she could be.
Oh, sorry. Representative Minter.
Thank you. Just a quick clarification on House Committee substitute. In subsection 18 relating to nurses, does this also preserve the current status of APRN licensure and temporary licensure for as long as this extension remains in effect?
Christy, do you know the answer to that? I'm
Yeah.
not sure if it does or not.
I'm sorry, I was trying to hit unmute without having to be on video, which I failed at both, so I'm sorry. Representative, this does relate strictly to their licensure. It does not address the collaborative agreement, if that's your question.
Okay. So yes or no, does it extend what we had in previous executive orders and from the special session?
Yes.
Okay,
It's exactly what was in, I'm sorry, it's exactly what was in House Joint Resolution 1 from the special session.
Okay, thank you.
You're welcome.
Representative Wheatley. All right, we'll move on to Representative Bratcher.
Thank you. Can you just quickly go over the prescription, 30-day prescription thing on that? I have a lot of people that wanted that. Can you just describe what it is? I know it's simple, but can you just describe it again?
Either one.
I'm sorry, Representative Bratcher. Do you recall the specific? I'm sorry, I'm searching through the pages to make sure I'm looking at the exact.
Can you give her a reference?
Well, it was in section
So I think that you're referring
Section
to
3.
Yeah, I think you're referring to.
I'm sorry.
The pharmacist is allowed to renew a prescription for 30 days without the approval of the physician.
And what is
I
it in
believe.
regular statute?
I have no idea. I'm not sure.
Okay.
I think usually you have to have the physician's approval. So in this case, the pharmacy can do it without the physician's approval, I believe.
All right. Thank you. That's all.
Okay. Seeing no more questions, I'm going to ask the secretary to please call the roll.
Representative Bowling,
Yes.
Representative Bratcher,
Yes.
Representative Decker,
Pass.
Pass. I'm sorry. Pass.
Representative Duplessis,
Yes.
Representative Flood,
Pass.
Representative Graham. Is that a yes?
Let me pause this. It's been pointed out I'm in such a hurry. I did not ask for a motion on the bill as amended. Could I have that?
Motion on the bill is amended.
We have a second. We have second by Representative Duplessis. Very good. So please continue with the roll.
Okay, Representative Graham.
Yes.
Representative Heath,
Yes.
Representative Heverin,
Yes.
Representative Johnson,
Yes.
Representative Maddox,
No.
No.
Representative Mentor,
Yes.
Representative Nemus,
Yes.
Representative Smith,
Yes.
Representative Stevenson, Representative Tate,
Mr. Chair, I'd like to record my presence as well as a yes vote.
Representative Tipton,
Yes.
Representative Upchurch, Representative Wheatley,
A pass.
Representative Miller.
Yes.
13.
We have 13 yeas. The bill passes to the floor. And there is a title amendment. We have a motion and a second on the title amendment. Going to have a voice vote on that. If we accept it, signify by saying aye. Opposed, like sign, and the title amendment has been accepted. Next item on the agenda is House Bill 56, sponsored by Representative Thomas Huff. Please approach the table, Representative Huff. Welcome, and pull the mics close to you. Turn them on and pull them close to you, and the floor is yours and your guest.
All righty. Well, what I'm here today to do is introduce House Bill 56. And what that does It creates a presumption that first responders who die of COVID-19 do so while in the line of duty and thus qualify for death benefits. It also has a retroactive clause to March 6 of 20, the first recorded death that we know of COVID-19.
Okay. Would you like to introduce your guest?
Yes. With me is, go ahead, Kevin.
Good afternoon. I'm Kevin Moulton. I'm the fire chief with Zolton Fire Protection District.
And I know you were really hit hard in Zonton by this. Would you like to give us a couple of minutes to talk about your all's experiences?
Ooh.
You don't have to. I know it's very emotional.
I'm good. We just hit our 1 year mark for the death of our fire chief, Rob Orkes, who first received cancer and was going through that process with the cancer, and was still very, very active with us in a lot of community events while he was going through this process. And later on through that process, he received COVID and passed away shortly, about a month after that. After he received COVID, once he went to the hospital, he never got out of the hospital. He went on the ventilator and never came off. And February, our acting fire chief at that time, Battalion Chief Gary Key, got COVID as well. Both were very active in the community, very active members with the Fire Protection District, and a great loss to the community.
Well, we certainly respect the sacrifice of those men, and thank you for your presence here today.
Thank you.
Do we have any questions on the bill? Representative Duplessis.
Representative Huff, thanks
Yes.
for bringing this bill. I do have a question. In the line of duty, obviously, is a term that we use with a lot of respect, that if an officer goes down the line of duty, we want, as a state, to obviously take care of that officer. In regards to COVID, how do we, or does your bill spell out how somebody would get that from the line of duty versus getting it from a family member or something?
Yes, sir. Well, the presumption is that if they're in the line of duty within 2 weeks of contracting the virus, then the presumption is that they got it in the line of duty. Does that help answer your question?
It doesn't have anything in there that they had to be exposed to somebody in their job, in their line of duty. It had to come from an exposure.
I don't know if you can determine where a person actually receives COVID. So, I mean, whether they got it, if they were on a 2-week vacation in Mexico and came back and were diagnosed with COVID, then they would not be eligible for this.
Right.
They have to be in the line of duty within 2 weeks.
I just know that, and I've had COVID twice now, and I've been vaccinated. And I'm not in the line of duty like an officer would be, but there's so many places to get COVID that it almost seems like almost any first responder that gets COVID and dies from it, the state will have to pay line of duty benefits, which maybe wasn't a line of duty COVID exposure. Any thoughts on that?
Well, absolutely. For one thing, our first responders, they go out, they'll pull you out of a car, they'll pull you out of a burning house. We had, I believe you said 3 in the last 24 hours were houses burned. So, I mean, they go in there without any regard for their own health, if you will, to rescue these people. Now, again, there's no way to determine where they actually received the virus. I mean, was it at the store last night or was it in the burning house last night? You know,
right.
There's really no way to determine.
I'll take chair privilege and just make this comment, though. You know, we in the summer up until the summer of 2020, I think we had this illusion we could contact trace and really narrow it down. I think with Delta and currently with Omicron, you just can't do that. I don't personally believe that's possible anymore. I don't know if anybody still tries to contact trace. I hope not, because I think it's a pretty futile thing. Chief?
With taxing the EMS service and them being so busy taking care of these patients, it's actually doubled, sometimes tripled a lot of the services, fire agencies to back up the EMS services. So the fire service is still hands-on to a lot of these patients, taking care of them until they can get an ambulance there. A lot of it just isn't car wrecks, and that's other types of incidents. But, I don't know many fire departments that really are not backing up their current EMS agency, whether it's county or their own, and still have hands-on on these patients. I can tell you, for instance, ours has gone up 53% since COVID has started, just medical runs alone, taking care of patients and backing up the county EMS service.
Okay. Representative Huff, you want to finish?
Yes, incidentally, there is a fiscal impact report included in your packet, and it says that the estimated fiscal impact is expected to be minimal and be mostly administrative in nature. Also, the KLC and KCO are not affected.
Right. Motion on the bill.
We have a motion on the bill. I do have some more questions, but I'll take a second on the bill. Representative Decker has a second on it. Representative Wheatley.
Thank you, Mr. Chair, and thank you, Representative, for bringing this. I want to provide a little clarification the way I understand the bill. So this is a presumption bill, which means there will be a presumption that the member has contracted the virus through this. It can be challenged. The other part of this is not full line of duty benefits through the pension system. This is a line of duty one-time death benefit of, I believe it's $80,000, which previously, through the experiences that the chief has talked about, was a little bit of a challenge to get to. And this is just making it clearer, easier to do. We've not had too many line of duty deaths related to COVID. Fortunately, there may be a few, but to capture the gentleman who, or the ladies and gentlemen, whoever is possibly has contracted and passed because of the virus, they will be eligible for the presumption of this benefit. And it is a one-time $80,000 benefit. It's not that, we're not talking about very much in a dollar sense there. Thank you.
Representative Nemes.
Thank you, Mr. Chairman. I was going to say the same thing that my friend from Kenton said. I would also note that it's minimal cost to the administrative costs, but it's not minimal to the individual first responder. It's very significant to them. And it is, again, to just highlight an important point that my friend Representative Wheatley mentioned, is this is a presumption. Somebody's going to have to make the case. All we're saying is, rather than the first responder's family having to make the case, it's now the administrative agency, and I think that's appropriate. Thank you, Mr. Chairman.
Thank you. Do we have any more questions? Seeing none, Madam Secretary, please call the roll.
Representative Bowling. Representative Bratcher.
Yes, and I want to say thank you to Representative Huff for bringing this. And Chief, I live in Fern Creek. I'm not far from Zoltan, so I know what you guys went through. Thank you for being here. Appreciate all you do.
Thank you.
Representative Decker.
Yes.
Representative Duplessis.
Quickly explain my vote. I think this bill has a lot of merit and needs to be considered. With that being said, I need to think about some things more, and I want to read some more on it. So at this time, I'm not going to vote no, but I'm just going to pass.
Representative Flood.
Yes, explain my vote. I do see this as a wonderful way to honor the frontline impact of COVID on frontline workers. And I really am glad that Representative Huff brought this bill. Thank you, sir. Yes.
Representative Graham.
Yes.
Representative Heath.
He's not here.
Representative Heverin.
Yes.
Representative Johnson.
Explain my yes vote, Mr. Chairman.
Please.
So I am voting yes, and I simply have to say that there is obviously a possibility that a line of duty finding here might not actually be a line of duty very unlikely, I would say. But ultimately, we owe it to our first responders and our firefighters to support them in this, and we owe them that presumption. And so I'm voting yes. Thank you.
Representative Maddox,
Yes.
Representative Mentor, Representative Nemus,
Yes.
Representative Smith,
Yes.
Representative Stevenson,
Yes.
Representative Tate,
Yes.
Representative Tipton,
Yes.
Representative Upchurch, Representative Wheatley,
Yes.
Representative Miller.
Yes. Motion carries with favorable expression. Same too shall pass on the floor.
Chairman.
Thank you, gentlemen,
Mr.
very
Chairman.
much.
Mr. Chairman.
Thank you for your time.
Next
Mr.
item.
Chairman.
Yes.
Could I record a yes vote?
Yes,
on that?
Representative
Thank
Bowe. Did you vote on the first Senate Bill 25? Okay, good. All right. Next item is House Bill 76, sponsored by me, and I'm going to ask my co-chair Bratcher to take the gavel right now.
I don't tear this place up. State your name, sir, and the floor is yours.
Representative Jerry Miller from the 36th District. Thank you, Mr. Chairman. House Bill 76 is about actuarial investigations of our pension systems, retirement systems. This has been heard in PPOB. It was recommended by PPOB as an item that they wanted to recommend to the body. And as provided by state law, our state administered retirement systems are required to undergo what's called an actuarial experience study to evaluate the reliability of assumptions used in our actuarial evaluations. A few years ago, this body passed a bill to standardize the reporting by the systems, which intended to require each system to perform an actuarial experience study at least once every 5 years, standardize that reporting, and so that we could everyone, even those non-financially oriented representatives and senators, could understand the impact of a bill. Assumptions fall into two categories: economic assumptions, which happens to relate to investment returns, payroll growth, things like that, and then the demographic assumptions, which is things like rates of retirement, longevity in the job, mortality rates. It's very costly to do these and requires an actuary, and that's really, it's the costly nature of the demographics why we only require these economic assumption evaluations every 5 years. This bill changes that so that the economic assumptions are to be done every 2 years in the summer prior to the start of a biennium, so that we will have that data prior to doing the budget. And the reason for bifurcating this is that since 2016, we've had some pretty big swings in our economic evaluations, or our actuarial experience studies, and most of the impact comes through the economic assumption changes, not through the demographic assumption changes generally. And so this bill would allow the demographic assumptions to stay on that 5-year cycle, because again, it's very expensive to do those. But the economic assumptions, which is most of the impact of the evaluations typically, would be every 2 years. The bill changes really don't impact our financials and budget requests until fiscal year 2024, and that is in non-codified language at the end of the bill. Recent history, again, has shown in TRS, 2/3 of the impact was financial in nature, and only 1/3 was in the demographic. JFRS as reflected in their 2021 valuation. Financial is not as big an impact there as demographic changes, but in KRS experience study, it's a little bit different. So with that, I'll throw the floor open, ask Mr. Chairman for any questions the committee may have.
Questions? Representative Wheatley.
Thank you. And yes, Representative, we did recommend this in PSO or PPOB, but I thought I heard you say something I want to be clear on. The actuarial studies that are required to be done every 2 years now on the financials. Was there a completion date during the summer or a start date is there a start date or a completion date listed as to when the study needs to be done?
Well, it would indicate that the financials economic assumptions would be done essentially in the odd years, in the odd years, so that we would have that data for the budget preparation. So that's what we talk about in terms of when is it really going to hit us. The 5-year cycle is unaffected for the demographic evaluations, which is the very costly. You've got to go back and you have to have an actuary, and they've got to do a tremendous amount of work to do that.
Okay, thanks. And I thought you had mentioned a time that it had to be completed by or started by.
No, sir. It's just that it's the cycle.
In that cycle.
It's in a cycle that every odd year that would have to be done and approved by the board.
Yeah.
Or it'd be presented to the boards.
I hope on PPOB we prompt them to get it started early in the odd-numbered years to have it prepared for us. But it takes a while for these to have it prepared for us.
And I'll count on you to lead that next year since I won't be here. So
we got some others who are retiring too.
Any other discussions, questions? Do I hear a motion?
Motion on the bill. Second.
Motion and a second. Madam Secretary, please call the roll.
Representative Bowling?
Yes.
When you say yes or no, please make sure your microphone's on and speak loudly if you don't mind. Thank you.
Yes.
Thank you. Representative Bratcher?
Yes.
Representative Decker?
Yes.
Representative Duplessis?
Yes.
Representative Flood?
Yes.
Thank you. Representative Graham?
Yes.
Representative Heath?
Yes.
Representative Heverin?
Yes.
Representative Johnson?
Yes.
Representative Maddox?
Yes.
Representative Mentor? Representative Nemus?
Yes.
Representative Smith?
Yes.
Thank you. Representative Stevenson?
Yes.
Representative Tate?
Yes.
Representative Tipton?
Yes.
Representative Upchurch? Representative Wheatley?
Yes.
Representative Miller?
Yes.
House Bill 76 passes with favorable expression. And we're adjourned. Thank you, guys.
Chairman Bratcher?
Yes, sir.
Before we adjourn, could I register a
Yes,
yes
sir.
vote for Senate Bill 25, please?
Senate Bill 25, Representative Johnson.
Mr. Chairman.
Thank you, sir.
Anything else before we adjourn?
Yes, I need to record a yes vote on House Bill 56.
Representative Heath, House Bill, what?
56.
56, a yes vote?
That's correct.
Anybody else?
I thought Johnson said yes. I already had him.
Representative Johnson was a yes.
Senate Bill 25, yes.
Senate Bill 25. All right. Okay, we're adjourned.